All right. Well, welcome so much, everybody, for joining our live stream webinar addressing rural transportation insecurity and workforce retention in Wisconsin. My name is Valerie Loeffler, and I'm the Executive Director and founder of Phoenix Mobility Rising. And we are honored and thrilled that you're joining us here today. So I know we have folks joining us live on Facebook, on YouTube, on LinkedIn, as well as who registered for the event. So we appreciate your support. We are using a new platform to do this kind of work. So we are excited to try it out. A little bit of logistics as we get started here for today. We're going to kind of talk a little bit about how to enter and add comments in chat because we have, as you can see, half an hour for a quality Q&A around different questions about the program and the project because we realize how innovative this is. We're going to have some opening remarks from Sam Rickers, who is the COO and Deputy Secretary for Waupaca Economic Development Corporation, and also Dave Morek, the Chairman of the Board for the Waupaca County Supervisors. And then we're going to talk about the Rural Mobility Challenge, what is Catch a Ride, our metrics and ridership, get into the details and the data, down to the miles traveled, the vehicles we're using. We're going to hear from actual riders of the program. And then we're going to talk about what's next and how we're going. And like I said, reserve lots of time for quality Q&A as we are diving into this work. So just thank you so much, everybody, for joining us. And let's get this party started. First of all, just if you are new to using StreamYard or you are watching this program via your Facebook or LinkedIn or YouTube, when you enter comments into that platform, it will pop into our chat. And if you are joining through StreamYard, you can see where you can click in there and join the chat. So please note we have it enabled so everybody can see your comments and things like that. So everybody can kind of like, oh, that's a great question. You can react to other people's comments. If you're like, vote this one up, I really want to get an answer to that one. So it's going to be super interactive. And but just don't put anything in there you wouldn't want your mother to see, if you will. So, all right. Well, with that, I am honored to share and turn the stage over to Sam Rickers, Deputy Secretary, Chief Operating Officer for Wisconsin Economic Development. Sam, the stage is yours.
Thanks a lot, Valerie. I'm really excited to be here. The Phoenix and Waupaca Catch Ride program is one of my favorites. I've had a chance to join a couple times in Waupaca County, and so just an honor to be able to join this conversation today. The Catch a Ride program, which was created by the Waupaca County and Phoenix Mobility Rising, it really, of the 27 workforce innovation grant programs that we were really honored to be part of helping administer, it's one of our biggest success stories. And that's the reason when asked to come talk about it, we jumped at it. The workforce innovation grant program, they were super special. They came out of dollars that came from really the pandemic recovery. But what they sought were grassroots solutions to local workforce challenges that were coming from folks in their part of the state, rather than dictating to folks what the solutions were. And so what was really cool is that in Waupaca County was that leaders, businesses, educational institutions, local governments, they already had a pretty good idea of some of the biggest challenges that was facing some of their bigger employers in Waupaca County. And certainly one of them was this idea of reliable transportation as a major barrier for folks across the region to get to their jobs, for the workforce to get to their jobs. But remember, this isn't a problem just in Waupaca County and its kind of regional area. We see it all across the state as a major barrier to employment. And it has a particular flavor in our rural communities. You know, if workers don't have a reliable way to get to work, I mean, the problems just compound. Employers throughout the state have told us that lack of transportation is one of the most common causes of employee turnover. Really great employees want to work, but when they can't figure out from getting A to B because of a variety of challenges, it creates real challenges, of course, for the families of the employees, but then for our manufacturers, our businesses as well. And if we can't meet those workforce needs, I mean, then we have a real problem for our broader economy. So let's talk a little bit about what we really saw in Waupaca County. It started really with the two local cab companies, as I understand it, providing some limited service. And so what was really cool is how Waupaca County Economic Development Corporation came together with partners like Phoenix, but also a number of other partners that were really thinking across both Waupaca and Outagamie counties, coming together with Waupaca Foundry, Theta Care being big examples. This idea of how you provide that type of transportation, not just on the 9 to 5 shift, but kind of the 24/7 rideshare services that could help workers get anywhere they needed to get to in Waupaca and Outagamie counties. And together with Phoenix, these organizers today, with the Catch a Ride program, they provided over 18,000 rides in just the last couple of years for 86 different employers, and over 500 unique riders served. I mean, if you think about those numbers and what that means to those families, what that means to those employers, the kind of employee consistency, the stability within those families, and the workforce stability that this program is providing for just a number of employers across Waupaca and Outagamie counties. It's so cool. They really have, we were looking for the larger Workforce Innovation Grant Program for projects, one that could serve as models for other folks in the state, but also as that could stand on their own. The dollars that we received in recovery dollars after the pandemic, in many respects, they were one-time dollars. And so you're really looking for partners that can pilot these investments, these ideas, and then stand on their own. And this program, the Catch a Ride program, has succeeded both on serving as a model and also creating a model that can get standalone funding going forward. And that's why we're all here today with this webinar. Just last month was really neat. Congratulations. Waupaca County received confirmation that it had been approved by the Wisconsin Department of Administration to receive rural transportation funds to kind of sustain and expand the program beyond that initial grant period of that initial investment through the Workforce Innovation Grant Program. And they've recently received that extension from our partner, Department of Workforce Development. And so we're just excited. I think one of the large investments we made, it piloted this really innovative idea. And now it's able to both continue it with funds that aren't coming just from this unique time, but they're also serving as a model throughout the state. I know that across the state, and particularly in rural America, in rural Wisconsin, folks are tuning in and they're sharing their best practices. And so I just want to congratulate the Waupaca County Economic Development Corporation, Phoenix Rising, and all the private and other public partners on everything you've achieved. Thanks for folks for tuning into this webinar. It's pretty exciting for our state and its workforce needs. With that, I'm going to have the honor of turning over to Dave Morick. He's the chairman of the board for Waupaca County. Dave?
Thank you, Sam. So good morning. It's a pleasure to be here. I am Dave Morick, chairman of the Waupaca County Board of Supervisors and a past president of the New London City Council. And I just want to say what a blessing it has been that Waupaca County Catch Ride has been for our community. I live in New London, and like many of the townships around New London, we do not have a taxi service, no or very expensive rideshare alternatives, and no buses. So if you want to work but don't own a car, good luck getting back and forth to work. I represent one of the poorer sections of New London. And it is not unusual to see workers going by on bicycles to get to work in town. For these people, it's a chicken or egg situation. They can't buy a car because they don't have a job to earn money, and they can't get a job because they don't have a car to get to work. We also have people who have lost their licenses but could never get one for one reason or another. And without Waupaca Catch a Ride, they would be sitting home without a job. We are also concerned about retaining our businesses and employers, many of whom had job openings that they had difficulty filling. We are concerned that they would either shut down or move to another country or state where they might find more workers. It's also tough to attract new businesses to town when they find out that they have trouble getting workers. In 2018, Theta Care's New London Community Health Action Team hosted a one-day plunge focusing on the issue of transportation. We looked at transportation data supplied by the East Central Wisconsin Regional Planning Commission that reported that of the 22,000 total households in Waupaca County, nearly 15% face transportation challenges, either from having no access to a reliable vehicle or more workers and vehicles in the same household. Waupaca County provides ride services for people 60 or older and disabled people, but a significant number of people ages 18 to 59 do not have access to a vehicle or don't have family or friends to provide transportation to businesses. So after the plunge, a partnership was formed of local businesses, including Theta Care that Sam mentioned, Theta Care Hospital, our Chamber of Commerce, various units of government, including cities, the county, and the state, the East Central Regional Planning Commission, and other government agencies, and nonprofit organizations like Lutheran Social Services, all working together to come up with a solution to the problem. Without this network of people working together on the project, the data to show the need, and the plan to implement a solution, the funding would not have been possible. But a Wisconsin Work Innovation Grant that Sam referred to was received in July of 2021. And by December of 2021, Phoenix Mobility Rising had the technical platform, employees, and vehicles ready to begin transporting employees to work in Waupaca County. Three years later, as Sam mentioned, we have transported nearly 19,000 employees to and from their workplace. We are especially very grateful for the efforts of our consultant, Phoenix Mobility Rising, for leading us to where we are today. It has taken a while, starting with a vision and a dream, to try to provide safe and reliable rides to people who desperately need our help, and watching that effort blossom into a very successful program. I am so very pleased with the results of this amazing effort. I would like to thank all those that were involved in the pre-planning, the grant application, and implementation of the Waupaca County Catch a Ride, and hope to see it continue to succeed for many years to come. And with that, I'll turn it back to Valerie.
Wonderful. Thank you so very much, Dave. All right. Thank you. It's an honor and a pleasure to be here and to have this opportunity to do such incredible work. Thank you.
Very good.
All right. So let's kind of learn a little bit more. So Dave did a fantastic job setting the stage, and Sam also gave a fantastic overview of where we are to where we've come in and really highlighting how big this was. This was a community-driven effort from day one. This program, this initiative, everybody coming together didn't just spawn. This was hours and hours of meetings and investments and phone calls and hundreds and probably at this point thousands of emails coming together, committed to making change happen. I think that's one of the unique things about how transportation is built but is also set to thrive, is that it has to be something that the community is fully invested in and that it responsive to what the community needs, versus this is an esoteric plan somebody wants put together and then you just kind of force it into the community. It has to respond and be supported by the community, and the system has to support what those priorities are, or it will not last time and time again. So let's learn a little bit. So if you're not familiar, we have a lot of folks who are joining this webinar from out of state. We have a couple of folks even joining from Canada and Europe. A little bit about Waupaca County. So population 53,000. So it's not super low density, but it's not high density by any stretch. 765 square miles, roughly half the size of the state of Delaware for anybody who's a geography buff. Unemployment rate, 3%. So we're not talking in a community where there's 15% or 20% employment. Folks are busy. Many folks work 2 jobs. So we don't have a super high unemployment rate. Median household income, a little bit south of the national average, but about $71,200. Residents living below the federal poverty line, roughly 10%. So a little bit lower than normals, lower than national standards. National standards about 12%. Residents without a bachelor's degree or higher education about 20%. The state average for the state of Wisconsin is around 35%. And so access to education, access to employment, access to jobs that provide educational benefits are very vital in supporting the community if we look across all needs. Now, what are the gaps? As Dave had shared, there are transportation barriers existing in the county, and what predicated this. Roughly 11% of the households in 2 of the main cities, Waupaca and Clintonville, have fewer vehicles in the household than working adults. So if you have 2 folks that are going to work, you're going to be going to 2 different places. You've got to have two different modes of operandi. If you look at some of the nearby counties, Winnebago and Outagamie, which are kind of geographically north, south, east, right next to it. I'm blonde, directions I'm not good with. My apologies. But that rate drops to 1.3%. So when you look and compare it 11% in some of the communities here in Waupaca and Clintonville to 1.3%, you can see there's a big disparity there. Rural workers are just disproportionately, words are hard, disproportionately dependent on shared public or informal transportation options. There are 258 employers here in the county when this grant application got submitted. We know that is building and growing, but as of 2021, when this application was submitted, 258. And we know from, conversations in the community, talking to writers firsthand, but also nationally and even globally, that I've talked to folks in Ireland, I've talked to folks in Australia. Transportation barriers in rural communities are structural roadblocks. They limit employment, economic mobility, and workforce retention. One of the major employers that was a big champion of this work getting started, they had reported roughly 89% of their employees that phase out or wash out during that probationary period reported transportation as the number one reason that they lost their job, that they weren't able to continue employment. That's a big number, but it also aligns. If you talk to chambers of commerce that talk to their HR departments, that transportation challenge happens over and over and over again. And so when we look at the geography of Waupaca County, there's 2 existing public transit agencies that are in the cities of Waupaca and Clintonville. The city of Waupaca, they'll go within a mile of city limits. They have service 6:30 a.m. to 9:45 p.m. On Friday, they stay open a little bit later to get folks home from festivities. Saturday, same thing, 7:30 starts a little bit later, but goes till 2:30 a.m. And Sundays, 8:30 to 3:45. In city of Clintonville, they will go a little bit further outside of the city limits, 8 miles of the city limits. They operate predominantly daytime hours, 7:30 to 5, Saturday 9 to noon, Sundays closed. Why does this matter? This shows, I wanted to put and kind of detail out where these hours were and the timelines were, because that matters when it comes to that third shift. Or if you need to get somewhere after 5 o'clock, you need to get to daycare and then get home. If that service in Clintonville is closing at 5, you're not going to be able to get pick up your kid from daycare or from school and get home at that time. Or there's going to be no options for that third shift, getting to work or getting from work. Same thing in the city of Waupaca. You might be able to get to work, but you might not be able to get home if on Monday through Thursday if you work third shift. So those gaps in service are a big challenge. The other thing was there's no connection between communities. You can't go from New London to Waupaca, New London to Clintonville, Clintonville to Waupaca. This was a huge challenge. And in the data, you'll see from Ollie, our director of mobility here later on, he will show just how many cities and the importance of that interconnectivity that's available and highlight that. It also shows there's limited support for services available on weekends. And in a manufacturing environment, in a service economy, there's a beautiful lakes here. If you are ever needing to go and interested in coming somewhere for a fun weekend or a fun trip, the lakes here are absolutely beautiful. It is gorgeous. But the tourists during the summer take up a lot of capacity in the transportation ecosystem. That makes limited service available on weekends for employment. So just giving folks a little bit more context of understanding where these barriers lie. So now let's talk about what is Waupaca County Catch Ride in a little bit more detail. Sam and Dave did a great job giving kind of an overview, but let's get into kind of the 411. So this program was launched with the funding from the Wisconsin Workforce Innovation Grant. The lead grant recipient is the Economic Development Corporation of Waupaca County. They are the leaders, the champions, the community conveners. They have been absolutely phenomenal partners in bringing the community together and bringing the businesses together, in really amplifying and providing leadership and guidance, but also support. As we've run into when you deploy programs, you're like, how does this work? And what are those moving pieces? They have been phenomenal at saying, okay, well, let's break it down or let's make some phone calls. So I just want to give a huge shout out to Jeff McCorsky. He is the executive director of the Waupaca County Economic Development Corporation. He is watching his daughter graduate from college today in West Virginia. So super excited for him. He's unable to join us, but we're going to be doing another one of these and he'll be able to be here. And so just in terms of who leads these kinds of initiatives, having the Economic Development Corporation has been a godsend. In addition to Phoenix, Make the Ride Happen, which is a program of Lutheran Social Services, has been working hand in hand with Phoenix. They're actually the partners that we started working with in Wisconsin back in 2018 in a different county. And when this opportunity came up, they were already working with Theta Care in the community. So Holly Kramer, she since has retired, but she has been a champion and a guiding light for Phoenix and for the community, and saying, how do we respond and how do we establish transportation programs to support the community? This service was deployed first and foremost to serve employment rides. So if you're using the service, our number one job is to get you to work. If there's capacity, we've got some downtime where we have peaks and valleys and shift schedules, right? We're providing additional rides to get folks to the doctor, to get folks to the grocery store, to get folks to the bank, social services, sign up for housing, legal services, so on and so forth. Again, Ollie will tee up and provide more detail, but by and large, the vast majority of the rides that we are providing are getting folks to work, and we're addressing the gaps in the existing mobility ecosystem. We are not duplicating service. That is a number one priority of Phoenix. There is not enough money to go around in this industry, so we need to squeeze every penny, every cent out of every dollar to make that money and that taxpayer investment a very wise and efficient use of resources. As we talk about these partners and these the programs coming together, we had all the chambers engaged. We had the university, the planning commission, city mayors, council members, villages, major manufacturers. Everybody really came to the table to make this program successful. So while we get to tell a lot of the story, it is really just an honor to be able to highlight the incredible work that the community has done as a whole. It really has been an endeavor of everybody rolling up their sleeves, putting in time, meeting every other week, meeting weekly in some cases as we were launching the program to make this a success. So it is definitely not, Phoenix, we certainly put our blood, sweat, and tears out there, but it is really the product. The success of this program is because of the community's investment and because of the community wanting this to be successful and knowing how important it is to get folks to work. So we launched 5 vehicles and 8 drivers to provide 24/7 microtransit service outside of those areas where there was already taxi service. This made sure we could get folks between communities in the outskirts and also get folks to where they needed to go to work during nights and weekends. Lutheran Social Services and Phoenix, Make the Ride Happen and Phoenix, we tried like the dickens to recruit volunteer drivers. We have a few, but boy, volunteer recruitment post-pandemic is a whole different ballgame. But we do have some volunteers who are providing rides and provided rides as part of this program. We partnered with the local public transit in Waupaca. There is the same company runs both the city transit. It's owned by the same people, but 2 different companies, Running Inc. and Brown Cab. They run the public transit in both Waupaca and Clintonville. And they said, let's start in Waupaca with this technology integration or the collaboration. And then we also deployed a call center that has language line assistance. So we can connect with translators, live translators that speak over 300 languages. And we also have call center agents who speak Spanish. And so that service is available from 5 a.m. to midnight. Roughly a third of the folks who are booking rides call. They just love the security or the connectedness. Here we are, Friday morning, everybody. But they just want to talk to somebody. And our team is really kind and really thoughtful, and we do our best. And so it's also just somebody friendly to talk to me, like, hey, my shift changed, or hey, I need a ride to work next week, but I'm going to also need this other trip. You guys got time for that? So we have a call center. So this isn't just some flash in the pan, boom, we got a fancy app and we get some cars on the road, bingo, bango, we're done. This was a lot of collaboration, recruitment, investment. And then we deployed this one call, one click mobility as a service ride booking technology. And this technology is some of the most unique system design in the world. I literally flew to Singapore to find out about this technology platform, and it has been a game changer for us. So here is the app, and I'm also going to share a little video, but it basically will show you can put in your pickup and drop off address just like any other app. And then you have your mobility options. So if you have a service animal, if you use a wheelchair, if you are going to have a care attendant with you, we know that. We also get the trip purpose. So that's how we're able to track how many rides are going to work. We also you can schedule your return trip and then add any notes to the driver. From there, then you can see the different options that are available based upon the time of day, the day of the week, and your pickup and drop off geolocation. So for example, you can see here based upon this trip, maybe I'm going from the grocery store to work. So I'm at Piggly Wiggly getting some errands, and then I'm going to go to work at the Foundry. I can see I've got 2 options. I can take the microtransit or I can take Waupaca Taxi, but the volunteers is grayed out because we request 3 days in advance to give those volunteers time to work that in their schedule. So they can see, if I want to ride with my volunteer Ron, I need to book further out. And then you review everything. So this is kind of the screenshots of that, but I will share here a video because we're going to try and do this because we like to do hard things at Phoenix. All right, let's get this going here. Haha, it worked. Here we are. So here you can see it in real time. You put in that pickup and drop off location, just like your Uber or your Lyft. And this technology is run by a company called Skedgo. They've received global awards for this innovation. You put in your pickup and drop off time. You can put your leave at or your arrive by. So in some cases, you're like, I don't know how long it's going to take to get there, but I got to be there by this time. We can do that. It shows you what your options are. As I shared before, you can put in your what mobility options you need. We worked with Centers for Independent Living, disability advocacy organizations to enhance this technology. You also then can track your trip purpose. So this is, again, where we get this really great data on how is this investment coming back to the local economy. You pick up your your time. And then based upon all that information, you can add a note if you're like, oh, I'm going to have my service animal with me, or, hey, I'm going to need a car seat. We had a generous local business donate 3 car seats to help make sure. And then from there, you saw those different transportation options. If you select Waupaca Taxi, there's different rates based upon the different type. And then you can request out and check a ride and book. And so you can either pay with a credit card, or we've just rolled out the mobility wallet. And then you're able to track your trip and see it confirmed. So just a really great, simple to use, easy app that enables folks to not have to call in if they're trying to book a ride. There's also a web interface where you can book a trip if you like to use your portal. And then there's also what we call a community booking account. So this is also another innovative platform. I'm going to show another video because I like to show a video. I think sometimes it's easier to see it than it is to try and explain it. But it's a computer interface. We have over 200 community partners across the United States that use this portal to book rides. And so we use this with healthcare partners, shelters, and HR departments, you name it, and they can log in, they select their staff member or their patient or their employee, they put in that pickup and drop off address, same thing as the app, they put in the mobility options, what they're going to need, so on and so forth. And then from there, they select the trip purpose, if there's any trip purpose. And then if they need a return trip, they can select that, and they don't have to put in the address again because that's a pain. They just have to say, what's your return if you're going back, what time you need to get picked up. And then just notes to the driver if you have anything you want to share. From that, then you can see the different transportation options that are available, the microtransit, the public transit, so on and so forth. So you really have that mobility as a service. And then you can select, and you can either pay with a credit card, you can pay via invoice, or you can pay via mobility wallet. So all of those options are available. So in addition to having this really cool fancy app, there's an interface that support community-based organizations, corporations, employers to help get folks to work when they want to be the one to make the pay or make that payment, but not have to book it through the app and then do reimbursement and all that jasmo. All right. We also, as I mentioned before, Make the Ride Happen, which is a program of Lutheran Social Services of Wisconsin and Upper Michigan. They have been vital partners throughout this entire program, and they have expertise in passenger support with complex needs. So many times one example partner is World Relief of Wisconsin. They had several refugees from Tanzania that were trying to get jobs in New London at the Tyson factory, and they were coming from Appleton. And anybody who's worked with refugees and resettlement, there's a lot of moving pieces. There's language, there's licenses, there's housing, there's unique food, all the things. And Lutheran Social Services or Make the Ride Happen have been just incredible blessings, seeing how can we create that screening and that wraparound support. What also they support is if somebody says, hey, the ride cost is $3 for that pickup and drop off, but I can't afford $3 right now. My bank account is negative. There is nothing to give, but I got this job and I need help getting there. So individuals who are living in households with an income of 250% of the poverty level or below can qualify for free, no cost transportation for 30 days. And then at the rate of $1 a trip leg for up to 3 months. So we want to make sure folks can get that first couple of paychecks, because if you've ever been in that situation or you work in this space, many times it's going into a negative bank account when the bank gets the first paycheck, sometimes the first 2, depending on where you're at and what's happening. And so when you're trying to figure out how am I going to pay, we want to give folks some breathing room so they can get their rides, they can get some food, they can pay towards housing, all the things we need to live, right? So Lutheran Social Services Make the Ride Happen. Holly and Shannon, they are the A team. Love working with them to support these riders. Another piece of this, as I shared, was the community engagement. In Waupaca County, and all the programs that Phoenix leads, we deploy what we call a mobility leadership circle. This is a brainchild of a mashup of the national ITS America. This is the industry group that works with all the OEMs, all the technology vendors deploying the latest, best technology on our roadways. They have a leadership circle, but also there's a group called the CCAM, which is an organization that helps coordinate the 138 different federal programs that fund transportation. And they're working together. And we said, what if we tried to recreate kind of a mashup of that at the local level? We need to get the businesses together. We need to get the social determinants of health folks together, from healthcare, food, housing, employment, social, and the transportation providers need to be there for that conversation. And we need elected officials in the room. And we talk every quarter. How's the project going? What are the latest challenges we're running into? What are new developments? What are some stories? So it wasn't like, TV dinner, we're going to throw this program out in the community and walk away and see what happens and leave, these partners to their own devices. It really was hand in hand, the community leading the program, leading the project, providing guidance and support the entire way. And then in addition to that, this mobility leadership circle also has some action teams that were established focused on sustainability. So absolutely thrilled. You will not believe the sigh of relief I gave yesterday when I was talking with the county administrator, Ryan Brown, when he had shared the great news that Sam has shared today, that the state of Wisconsin has authorized rural public transportation funding to keep this work going, to keep this impact happening in the community. That would not have been possible without all the community partners coming together saying, what do we need to do? What are our next steps? How do we unpack this red tape? How do we learn what the moving pieces are so that we can keep this work going and these families can still maintain employment? As I shared before, community engagement was a big part of this. We also heavily were involved in the chambers and are involved in the chambers. We attend the events. We have team members that are ambassadors. We participate in parades and all those kind of things, because we really, this program, this service is by the community for the community. All right, so with that, I'm going to share a story of our very first rider, Teresa. She also goes by Kitty. She did our first ride December 15, 2022, less than 6 months. Like, we went from, okay, go, to deploying the vehicles, deploying the service, everything. Let's see here. Let's show this video. You can hear from Kitty directly here.
I was working the 2 p.m. to 10 p.m. shift in the ER. I didn't have to worry about missing my shift because of the weather. And once I was at work, I knew I was going to get home safely. Being on the road at night by myself is kind of scary. And I kept thinking, if I broke down on the road, no one would know if I made it home or not. This way, I always knew I had a safe ride home. I truly, truly believe this program needs to be spread out.
So that was Kitty, and wanted to share her story and the great work that was done. All right, let's see here. This is where the best laid plans here. Let's go here. All right. Next up, as you are listening, y'all, we have 6 comments, questions that have been coming in through the different platforms. Please, we have half an hour for Q&A at the end. So join us, enter your comments and questions, or wherever you're streaming. Don't wait till the end of the webinar. Go ahead and drop those in there. But with that, I will turn our presentation now over to Ali Hajjassan to share about our metrics and ridership. So Ali, if you want to introduce yourself, give a little bit of background about how you came to the fast and furious world of Phoenix and the rock star that you are, and then dig into the data. We can't wait. Thank you.
Yeah, I don't know about a rock star, but thank you, Valerie. My name is Ali Hajjassan. I'm going on a year and a half right now, maybe less. I'm the director of mobility at Phoenix Mobility Rising. So I met Valerie when I was still working at Ford, and her mission, and when we talked, really energized me to jump across and come join the team. And ever since, it's been really exciting work. Really enjoy it. So I'm responsible for the drivers, the call center, and the mobility navigators. Really, really excited to be here today to go through some metrics and to tie this back to what Valerie mentioned. So let's go through some of the numbers, some key highlights. since the start of the program in December of 2022. Total rides provided is just shy of 19,000 for the Catch a Ride program. Our average monthly rides is 677 approximately. Total clients served, and this is the critical number, 531. These are not, most of them are repeat riders, but 531 people in that short period of time. Total distance, shy of 215,000 loaded miles. And then our average loaded distance is just above 11 miles. Okay. Drilling down a little bit further. At the start of when the program started in 22, took a little baby steps, and we had 12 successful completions. And you'll see that the progression over time, and it's really telling of how successful the program has been. 23, we reached almost 6,500 completed rides. In 24, surpassed it all the way up to 9,200. And year to date through April, we're at 3,277. So kind of mirroring what's happening in 24 for a total of the 18,959. That chart on the left upper corner, what I wanted to do some month-to-month comparison between the first 4 months of 24 and the current 4 months in 25. And you'll see they're really in line with each other. A little bit flat, but trending. It's not trending down, but definitely lock in step with what we did last year. Okay. Some of the areas that Valerie mentioned, this gives you a little bit more granularity of the cities that we're supporting. Waupaca is the biggest one at about 45%. And you'll see all the other cities, New London, Waupaca, Clintonville, all the way to Marion. So smaller percentages, but we're providing rides to all those communities and helping the folks in those areas. Okay. Okay, so I wanted to go into kind of tie into those numbers as well. On the left side, you'll see the ride purpose, and then correlates perfectly to the mobility options. So 93%, almost 93% is all for employment. This is really compelling data. It ties in what Dave said during his portion. People need to go to work. They don't have a car, and there's the data. And then the other ones, when we have capacity to provide support, we do it for legal, school, recreational, medical, and groceries. But the majority is employment. And then obviously the people that are working do not have any mobility needs. So it's really right in line with those numbers. Okay. The service breakdown. So this is between the Phoenix Mobility Rising drivers, the public service transit that we have partnered with, and the volunteers. The bulk of the rides are provided by our own drivers at 18,455, and the public transit service, which is Waupaca Taxi. We started partnering with them in March of 2024, and they've been they've supplemented us really since that start date. So when we reach our capacity, that overflow goes over to Waupaca Taxi, and they've been very helpful in continuing the mission to support the riders, so we don't leave anybody behind. And then we've had last a couple of months, we've had a couple of volunteers provided 28 rides. We will continue to grow that front. So more to come on the volunteer avenue. And then just recently launched in May of this year, we've partnered with Theta Care to provide rides to their ER departments, to a medical facility, back to home, to other facilities if needed. So we've started that service. And this is when we expanded our hours to support them from a driver perspective and the call center. Okay. Okay, I want to touch a little bit on the technology that we've implemented in recent months. And one of them is called Liftango. It's a really excellent platform, one of the leading platforms globally. And this is just another step that Phoenix is going in directionally, as to use technology to be able to provide rides efficiently, expand, utilize the vehicles and our drivers. So I wanted to give a snapshot. So this is a breakdown since we started in August of last year, all the way through April. Shows the vehicles. I didn't want to, the numbers are there, but it just shows, where Phoenix is heading with using technology to implement efficiencies on an ongoing effort with integrations with our phone systems. So next slide. So this is the data that comes out of Liftango. You can get it every day. You can get it every hour. It's really live. I want to focus on the upper right corner, that bar chart that shows our peak service hours. So, and it ties in with the employment story. From 5 a.m. To noon, then from 12 to 4, and then again from 8 to 10 p.m. So those are our operating hours for the employment, but it's where it shows where the need is, and it's kind of correlates perfectly to the data that I showed previously. The lower bar is or the squiggly line is the duration of trips. Typically, we're between 15 to 20 minutes for an 11-mile ride. And then the left bar chart is the number of riders that have taken rides. So you'll see we have a lot of riders that have taken multiple rides, and you'll see the ones as the number decreases. Some people have only taken 2 rides, but the bulk of the riders are on the left side of the chart. Next slide. This is our service level agreement for departure and arrival time. This is more of a measure for our drivers to measure our if we're late or on time or we're early. For a 10-minute SLA, outstanding performance from our drivers, because they believe in the same mission that we do and the community. So the majority of time we're either early or on time. So definitely I'm very proud of the team. Next slide. This is our coverage area. It's a little bit difficult to see, but it's exactly what I showed earlier with all the cities that we support. The size of the circle is the number of rides provided to and from those locations. We are working to improve this image, so more to come on that front. Okay. Next slide. Stop right there. Thank you. We also use vehicle tracking software, some Sarah telemetry. So for safety purposes, obviously. The left side shows our safety score. We're at 93%. And then there's a daily snapshot of trips. This is for one day. So it's really, we monitor all this stuff. And then if you see the next slide, included with the vehicle tracking, we have video recordings. So to shows you where the vehicle is going and inside the vehicle for safety purposes for both the driver and the passengers. So we monitor this regularly for any issues that arise. We always go back and review them. Okay. Another tool that we use to measure safety on the driver front. So all of our drivers are set up with the tablets in the vehicles, and our insurance provider requires that, make sure that we track all the harsh braking, speeding. So we're at 98% compliant, and we've been above 96% for the last several months. Actually, we never dropped below that number. So outstanding performance with our drivers. we look at this at every MLC. And lastly, I think there's one more. Okay, I think I'm done.
All right.
Thank you.
Thank you so much, Ali. We're just still learning here. My slides are a little strange. So thank you so much, Ali, for that and for
You're
sharing the
welcome.
data and all the incredible work
Absolutely.
that you do. All right. Well, if you have any questions, I know I mentioned this earlier, but if you have any questions, we've got 7 comments in the chat. Go ahead and enter them wherever you're streaming or join them in. We'd love to get your questions answered. So now a little bit about community voice and what that employment impact has been. What has been that ROI? So I want to share a story about Dylan Goodwin. He has a really compelling story in how he came to use the Catch a Ride program and how
10 miles from
it's working
my
for
house
him.
to Alliance. It is a company that paints castings. We paint with different solvents for companies. We also work very heavily with the foundry. So I went from the foundry to a company that's contracted with the foundry. Well, I was riding home one night from work, and it's an electric bike, so I had some pretty good juice to it. So I was going kind of fast. Just before the underpass, and someone swerved into me and knocked me clean off my bike, which took a lot of repairs. I had to re-weld the back frame. Then I started walking back and forth to work. I'd also get pulled over by the police. They'd stop and say, "Hey, what's your name? You can't be walking on the highway. It's illegal, this, that, and the other." And then when they realized I was just trying to get to work, they're like, "All right, you can hop in." And then Josh told me about the Catch a Ride. And I was like, that sounds pretty cool, actually. So he showed me the app, and I started riding with you guys, and it saves me a lot of time. It's very convenient because every time when I'm right out the door, she's already there, usually 4 or 5 minutes earlier than the scheduled time waiting for me. I would say that it is too good. It sounds too good to be true, but this time it is just as good as it sounds.
Dave's commute, or Dylan's commute, was 10 miles. So he would have to leave his house almost an hour and a half to get to and from work, those miles walking. In addition to that, if you live in Waupaca or anywhere north of the what was that name? Anyway, of the north, we've got snow. Like when he was hit, and that was an accident, was in February, and it was 18 degrees outside. So you can imagine you're Dylan, you're trying to get to work, you get blown off your bike, it's 18 degrees out. You still have several miles you have to walk home and carry your bike. So Dylan is a champion for this program, and he helps us share about this for other programs, and he's saving up to get his car repaired so he can help him and his brother get to work. All right, so a little bit more detail. So I want to give a huge shout out and thank you to Trenton at Wisconsin Economic Development Corporation. Him and his team, they took all of our data from the first trip that we provided through September 2024. So this data, we're going to be doing another tranche of this analysis as we wrap up the program with the 3rd year of data. But in total, his team calculated that we served 187 businesses across 19 different industries. So just the impact that has in a community, that's over 70% of the businesses in the community we have helped riders get to. Roughly 75% of those businesses are in 5 sectors: social supportive, social services, retail, healthcare, accommodation and food services. I mentioned there's beautiful, this is a beautiful area. There's a lot of tourism here in the summer, and then manufacturing. 82% of those rides went to 3 sectors: manufacturing, retail, and healthcare. So this is kind of where did the impact happen in the local economy, and this is where. When we're looking at employer distribution and rider engagement, we served a broad range of employers. No single employer, including these massive organizations that employ 6,000 folks, no employer had more than 17% of the total rides, or a little under 10% of the unique riders. So this wasn't a employment program sponsored by the county to support one main one main organization. We really served a lot of riders across a lot of different employers. The average use per employer is about 3 rides. High engagement, 25% of employers had 14 or more folks using the program. So there was a set of high utilizers, but it was still a large number of those businesses. 114 businesses had at least one unique rider. 28 businesses had 4 or more unique riders. So you could see many times to help somebody get to and from work, it was just one of their staff. But that one person made the difference between having somebody there for the night shift or not, or having somebody there on that weekend or not. When we look at what's the return on investment, because $1 million a year is about what it costs to run this program, soup to nuts, mobility management, oversight, community engagement, gas in vehicles, or charging. We had one electric vehicle. What was the return on investment for taxpayers? Every dime has to go as far as humanly possible to have the biggest impact. And we were able to show, if let's say a third, 1 in 3 of those riders, it really made a difference for their job, whether they gained or retained that employment because of program. The average compensation in these sectors based upon the type of employment was around $42,500 a year. If you account for benefits and local economic data, you're looking at generating $6.7 million in returns into the community. That financial ROI is $6.76 for every dollar. And again, this is a very conservative estimate, assuming all the other rides that were provided didn't have any economic benefit. So again, this is a very, very conservative estimate of where the change is happening. Now let's zoom out a little bit and look another step further, because when folks are able to get to work, they are able to participate in employment covered health insurance programs. They're able to get off of other supportive services like SNAP or EBT dollars. If you say, what was the average just tax revenue, tax to tax dollars, income tax, payroll tax, sales tax, just from those 159 folks, we're looking at roughly $1 million in additional tax, plus the reduced investment in estimated SNAP, Medicaid, so on and so forth, using some economic models. You're looking at $1.40. For every dollar of tax money that went into this program, $1.40 went back into the community. And this is a very, very conservative estimate, right? Now let's zoom way, way out. When folks are able to get to work, they're able to get to where they need to be. They're able to support their families. You see fewer ER, fewer mental health events. You see reduced incarcerations. Dylan shared about having law enforcement help pick him up. I was visiting with Ryan Brown, the county administrator, yesterday, and we're talking about how important this is to help get folks to and from jobs once they're released from the justice system and all those kind of things, right? Local economic simulations. These are folks putting money into the economy, buying stuff at small businesses, buying uniforms and shoes for kids, all those kind of things. Total social ROI. If you look at the whole enchilada, almost $12 returned in total community value for every dollar spent. And as we get this data and as we continue to look at this, we're going to be doing another set of this. And so if you're a university partner watching this and you want to partner with us to really dial in these numbers, we would love to talk to you. So now what's next? Where are we going with this program and how do we see it continue? So as Sam had mentioned, they extended the program. We've got 3 more months. We've trimmed the budget a little bit, cut some expenses. We're making that budget last 3 more months, and continuing to provide service. And as I shared, analyzing that data, because that data that I shared with you is just through September of 2024. And what we anticipate doing, as Sam has shared, is transitioning this to a rural public transit ecosystem. Agape Mobility and Yafi Consulting did a great job of putting together a report for Wisconsin Department of Transportation on how this program could be sustained and what that looks like. And so we'll be using 5311 funding if you're familiar with US DOT dollars. There's also some WeTap funding that's supporting some of the support and mobility management, and then matching funds, employers, foundations, private donors, and also contracted services, providing those rides to help get folks to and from, and maybe even other events and activities. As just a little bit of background about Phoenix, we are a 501c3 organization, and our mission and everything that we do is mobility solutions for the health and well-being of every person in every community. So as we deploy this program, as we lead and support the community, one of the things that we have learned and how when we put this together and where we're going is to set up what we call transportation assistance hubs. So this is basically a one-stop shop across multiple modes to ensure folks can get to social determinants of health. So the Catch a Ride program would be the impetus of this transportation assistance hub supporting the community. And many elements that we deployed as part of the Catch a Ride program are a part of the hub already. The staffing, the technology, the community support, and the capacity. One of the things that we'll be rolling out, as I said, is that mobility wallet, which is that ability for somebody to book rides independently in the technology to be able to then pay and receive that reduced rate or not have to pay at all. Maybe somebody's unbanked. Or if a employer says, as part of your benefit package, we want to provide you a set of funds to use to get to and from your first 30 days, but they don't have an HR person who works overnight to book and schedule those rides. The mobility wallet will enable folks to be able to use those services to get where they need to go and just draw down and book independently. So I'll share a little bit more video about that if we've got time, but I'm really excited about rolling out that technology. In addition, the enhanced mobility navigation. One of the key things that we know and that we really want to strive to do is that as folks are using this program, that we're able to then help them reach sustainability and free up capacity in the ecosystem to support other riders who need help getting from A to B. So this enhanced mobility navigation with our team, not only looking at how do we support free and discount rides or referrals to social service organizations, but can we help you get your driver's license? Can we help you get a short-term car in the instance as you're working towards building your credit? Can we help you find and build partnerships where we can get vehicles procured that are not with shystery payday lenders that charge 40% interest and charge you for a 7-year car note when the vehicle will only last 18 months. All these kinds of things, we want to support the complete mobility ecosystem, not just can we get you a ride within the system, but how do we help you get you everywhere you need to go in the most efficient way possible. And because we are using federal dollars, this project is being supported in whole or in part by the federal award number SLFR-PO 135, awarded to the Waupaca County Economic Development Corporation by the Wisconsin Workforce Innovation Grant program by the U.S. Department of Treasury. So thank you for allowing me to provide that public service announcement. With that, we now have some comments and questions in the chat. There are 10 different areas here. So with that, we are going to turn it over to Q&A. And if you have more questions, drop them in their comment section and we will keep it going. So with that, I'm going to go ahead and remove the slides here and check out and see what we have in the stream. All right. Let's see here. What else do we have? Kaylee has a question. Can they book multiple locations within one trip? For example, if they need to stop to get their prescription medicine and go to the grocery store before going home. So they can book multiple locations within one trip, but they just have to go through and book. So I guess they can book, but they wouldn't be able to do an automatic return. So they would book one trip to go from the doctor to, or from the, let's say, so they're going to their home, they're going from work to go pick up their prescriptions. And then and then they need to go to the grocery store, they would just book one trip from work to the pharmacy, and then they would book another trip from the pharmacy to the grocery store. So you can book those trips and you just have to work around those moving pieces. So absolutely, we can do that. It's not quite, you can't like trip chain to multiple different locations, kind of like in Google Maps. But absolutely that is possible within the technology. Got another question from Dana. Can they have a reoccurring ride with a consistent driver? So absolutely, they can have a reoccurring ride when they call to set it up, or they go in the app. They just need to book that ride independently, one at a time. Or we're working on multi-load, or when you can say, yeah, I work Monday through Friday and just schedule it. what we found with that in doing that in the past, because that used to be a functionality and we've used other platforms that allow you to do that, where you can say, I go to dialysis Tuesday, Thursday, Saturday, or I go to work Monday through Friday. What we found when we do that is a high amount of cancellations, because life happens, weather happens, times change, and people are just, you forget. You're like, oh, shoot, I forgot to tell you, I've got to take my son to the dentist on Tuesday. I'm not going to be there. And you tie up a lot of really expensive capacity, making sure that driver's available, again, especially since we're going 11 miles or 15 minutes. And sometimes we're driving two deadhead miles for every mile we have somebody in the car. So we may be going out of our way to go pick somebody up to then bring them in. And so with those reoccurring rides, we found chair times change in dialysis, appointments run longer, things like that. And we see a high percentage of income, or a high percentage of cancellations if we just let folks, I'm going to book Monday through Friday, reoccurring 8 to 5 or 11 to 2 or whatever those shifts are, or those appointment times. But the question around the driver, sometimes maybe. How that works with the technology is it's based upon the other rides that are happening in that ecosystem. So if there are other folks who need to go from A to B, that technology is dynamically routing the drivers in real time. The drivers do not know where their next ride is past 15 minutes of where they're at right now, because in many cases we're dynamically routing them with the Lyft Tango program to multi-load to get fixed in as many as possible. So in some cases, we have lower ridership and we have a driver that serves, as our night driver. For example, we have a retired law enforcement officer from a nearby county who runs our night shift and does a lot of those rides. And so many times he sees the same folks time in and time out. But in many cases, especially daytime hours, or if you're with a volunteer who may have time to take you most of the time on Tuesdays, but sometimes on Tuesdays he's out fishing, right? So that is a little bit how some of that can be navigated. Dana, great question. Next question is from Demetria. Is the service income-based and how is payment processed? So as I shared a little bit into the webinar, the service can be reduced. So we can provide through the program subsidies, we can provide free rides for 30 days, and then we can process that payment via credit card. That's right now when folks book through the app or they call through our call center, it's $3 each trip leg. So a ride to and from work costs you about $6. And they can pay with a credit card, or we can set up a mobility wallet if they're unbanked or they don't have a credit card or it's being subsidized. And then that mobility wallet draws down and those kind of things. So that is how it is set up right now. There are other programs that are out there that we've explored. In some cases, we have community partners in other locations like Dallas, where the community partner pays for those rides to get them to and from work. If they're part of like a work release program or something like that, or they're part of a specialty program that's focusing on cancer care, they'll pay for those rides for the individual, and there's an income basis, then the sliding scale within the clinic. Great question. Dana asks, what systems did you put in place to measure ROI? About every thing we thought we could that didn't create barriers to utilization. That's a great question. So when folks wanted to use the service, they could just download the app. You can download the Catch a Ride app in the App Store or call our number and schedule that trip. We did not put layers in front of using the program to add, what do you want to call it? Like, why do you need to know what kind of health insurance I have? I just need a ride to work, right? Those like questions that come up frequently when you're rolling out service or when you're rolling out programs. Folks just need to get where they need to go. I don't want to have to answer your 300 questions. So we didn't put a lot of things up front. We did do programs where we sent out a survey. We offered $40 in free ride credit for folks who took the survey to then be able to schedule and request trips. So that was one of the biggest things that we were able to learn a little bit more about, did they make more money as a result of the program? Did they get a new job as a result of the program? How much did they, what kind of employment they were working in, things like that. But really a lot of it is on the back end when we're looking at the trip purpose, when we're looking at all the distance and the data from all the miles and the types of vehicles and the types of fuel, those kind of things. So we put a lot of systems in place now that we're 3 years out and we're looking back on it. We're like, man, I wish I would have done that, or I should have asked that question. But definitely we did our best and we kind of learned as we went. Great question. Let's see here. Carrie had a question related to volunteers. Do they use a technology to get and report rides, or does Phoenix do all the recruiting? Do they volunteer for Phoenix or make the ride happen? Great question, Carrie. The volunteers use a separate platform that we use called Spedsta. So Spedsta is a technology platform out of California that is built for small transit systems or for volunteer programs. And it's kind of like a volunteer-esque Uber, where they can log into the platform and see what trips are available. And then they can say, oh, okay, I'm free on Tuesday, or, hey, I like to take folks to the doctor. I'll do these kind of rides, or, oh, I live in that area, I can grab that trip. So the volunteers used a technology to accept the trips and go back and forth, and that interaction happened within the platform. So we absolutely did. Both Phoenix and Make the Ride Happen were actively recruiting volunteers throughout the program. So it really was a tag team effort. Sometimes we both sat at tables, sometimes they went to different events and we went to events. And really just, it's as Carrie, as sure as you know, it is hard to find volunteers post-COVID in this kind of space. And especially in a community where a lot of folks are still working. There isn't a large number of folks that are, saying, okay, hey, let me just volunteer and drive. They're busy volunteering at their church already. They're busy volunteering at other events that are happening in the community. So I also think as we are in the community longer and as we're more visible, that volunteer piece will pick up, but it really truly does just take time for the community to come together and then to find the right folks and build that up. But they do use technology, and we have tried all the things to help figure that out. All right. Great question. Dana asked another question. How do you think this could be translated into a rural area that is less dense and more geographically dispersed? That is a great question. So in essence, it really is just how many more vehicles and drivers can you put in that area? We have worked in rural counties in Nevada that had basically one or two mining operations and one small health clinic. We've worked in communities like in the coastal bend of Texas, where it is very rural, it's very dispersed. But I think what happens is the trip purpose becomes more coordinated and more concentrated, because your average ride cost is probably north of $100 each leg because you're going so far. One of the things that was done in Minnesota was a rural rides program. We're trying to kind of figure out how we can morph it into some of the other programs that Phoenix works in. But this was a state-run program by the Minnesota Department of Transportation, where, let's say Dave and I, we're riding to work together. And Dave says, hey, Valerie, I can help you get to work for the first couple of months. I'll just swing by and pick you up. And then Dave receives the mileage reimbursement for helping get his colleague to work. And Arrowhead Transit, one of the partners we worked with, they had over 380 volunteers helping their colleagues get to and from work in this very rural, dispersed area around Duluth and all these other counties. Escapes me, it's 2 years ago. But that is a program that we would love to try. We also did a program kind of similar to that around healthcare access outside of Bexar County, outside of San Antonio, where we were helping patients who were getting to dialysis, cancer treatment, things like that. And the health system was like, hey, we're right now spending a fortune on paid drivers. What if we were to pay mileage reimbursement to their family or friends or their neighbors to take those rides? And so then we worked alongside that health partner and deployed the volunteer drivers in that program. Again, very rural. And it was a third cheaper including covering the cost of the administration and mileage reimbursement. It was a third cheaper to pay a family or friend to provide those rides via mileage reimbursement than paying a third-party service. Let's see here. Lorenzo has a question. Do employers invest in the program operations? And if so, what percentage of the costs are they covering? Lorenzo, this has been a topic of conversation. So what we are now in the space of doing is putting together some formulas and some data and going out and getting ready to make these asks. We have had employers that we've written grants to and received funding from their foundations, like the Tyson Foods. They donated $25,000. Theta Care has donated $20,000. We're applying for another $20,000. So local partners and local businesses have contributed. We received a $10,000 grant or a $10,000 award from one of the local banks and credit unions. And so we have not said, okay, this is the number of rides, this is the formula, this is how much you owe. What we are now in this space to do, and it takes time, right? So this is one of the only programs in the United States that offers this demand response rural service 24 hours a day, 7 days a week in a rural area. And like Dylan said, when you tell an HR manager this, there's two things that go on. They're like, oh, this is an issue, but I don't think they'll really use it. Or I don't think your service is out. Is it really 24/7? You guys probably close when it gets dark out, right? Like you have to build trust with the employers and the HR departments and those businesses to say, this service is actually going to cause a benefit for my employees. The second thing is a lot of businesses know turnover is an issue. They know transportation is a barrier, but they do not know to what extent. And so we were fortunate to have a couple of businesses who did put pen to paper. One of the businesses calculated the average cost of turnover is $8,000 per FTE. That covers the cost of new hiring, new interviews, job training, posting, advertising, finding folks. $8,000 is a lot of money every single time. That buys a lot of rides, right? But you have to take the time to say, well, why did this person get fired? And was it they just didn't want to show up, or were they not able to get here, or was it just not a good fit, right? Like employment's complicated, period. But this transportation barrier, what percentage of folks are returning over have issues with rides? And what is our responsibility to fund this? If you go to California or you go to the East Coast, there are, these programs with Amazon and Facebook, and they'll white collar take these, VIP engineers, and they'll put them in little vans and take them where they need to go. And make sure there. But when you talk about frontline manufacturing, frontline folks who are working in hotels and hospitals, many times those aren't the folks that are getting that VIP treatment or that ride to and from work. So this is flipping that model on the head and saying everybody deserves to be able to get to their job. And so when we talk to these employers, it's them understanding how much of a barrier is this within our organization. On top of it, you have to build the trust of the employees. Do they feel like they are safe, and can they get there? Like we have had times where it's bad weather or the schedule gets backed up. And there was a gentleman who said, if I would have gotten to work 2 minutes later, I would have lost a $1,200 on-time bonus. It was $1,200 to support his family and help him with what he needs in his life. Every minute matters. And so for us, those employees need to know, I can use this service, I can rely on this service, and I feel safe in this program, even at 2 a.m. alone. And that goes back to safety. A lot of our drivers have worked in health and human services or law enforcement, things like that. And so they really have a deep respect and appreciation for the quality of service and support that's needed, especially if you're a woman traveling alone and at 3 a.m. getting picked up from your shift that ends at the bar, right? Who am I getting into a car with, right? So you really want to make sure that when you're rolling out these services, it's the employer needs to be aware of what and how much of an issue this is. The employees need to feel safe and trust the service. And then time. It takes time to say, okay, well, we're going to ask you for $125,000. You ask any HR manager, do you got an extra $125,000 in your budget you can just throw into this fun program? Not very many HR departments have that to just like, oh, that's great. Yeah, absolutely. I was wondering what I was going to do with that money, right? Like it takes time. And so then they need to then write that into their budgets, fight for it to get that increased or cut other expenses to make room for it. And then they're able to make that investment. So the 3 years of this program rolling out and this rural public transit funding, that was huge to be able to build the program, build the trust, show the impact, and now really go to those businesses and ask for that investment. We have some of the businesses, we've provided north of 3,000 rides for their employees to get to and from, and that makes a big difference in their bottom line. But it's not like they're just sitting outside going, oh, so-and-so came in via Catch a Ride today. Oh yeah, that's the 15th one today, right? Like, so this is all about layers and building trust and time. So we do have some employers that have invested, and we're getting ready to go out and make some of those more dedicated asks, but it's delicate, and it certainly, we know it will take time. But that's a fantastic question that we've thought a lot about. We've been thinking about since literally our sustainability committee from day one, is saying, hey, if these businesses are benefiting, they should be putting money on the table because they're not paying that exorbitant amount of money to retrain or those kind of things. So yeah, great question, Lorenzo. All right, let's see here. What else do we have? Let's see here. What else? Will this presentation be available afterwards? Absolutely. Please go ahead and let us, we will send the slides out. So if you registered via email, go ahead and we will. Wow, you can tell I'm fading here. We will be sure to send the slides out afterwards as a PDF, and then this will be available live on YouTube. Now that I'm saying out loud, I'm going, oh, this is going to be available on the internet. This is going to be available live on YouTube, Facebook, so on and so forth. So we'll send the link out and the video recording and then the slides. So yes, absolutely. And I see Mark, we've got some questions here about the area, and I know we'll follow up with you about that. Let's see here. Who else's questions? What else is, I think, did I answer everybody's question? Claudia, yes, a beautiful comment, Claudia. Thank you. What an impressive program and presentation. I'm working in a rural county in South Carolina, assessing the transportation needs in the county. What advice would you have in developing the local research that would inform types of services and funding to explore? This county is on the South Carolina-Georgia line. Great question, Claudia. So what I would recommend is a couple of things. One, your hospital or your local health system has a community health needs assessment. Every nonprofit health system in the United States is required to do one of these things. They should be done every 3 years. Sometimes it's 6, sometimes it's 9, depending on turnover in life. But that in and of itself will be spot number one I would start. Next, I would say the local chambers, and the chambers in those businesses already have an established network, established relationships. Many times those chambers have HR subcommittees of HR experts that come together, and those folks are talking about how do we find employees in our rural area? How do we recruit? How do we keep young talent here? How do we get folks to job training programs or community college or all those things here in our local area? Those chambers are great starting points to have those conversations. The other place I would look is in the faith community, find out what are the big churches in that area that are serving and reaching out and providing service in the community. They many times know who the movers and shakers are, know the local dynamics of who might be interested in supporting, where the challenges are. Some churches in rural areas, as you know, Claudia, they're providing rides for friends and participants in their congregations or parishioners. So I would definitely start, number one, the rural health system and their population health, community health administrator. Next, the chambers, and then third, the faith community. Those would be the 3 places I would start to have those conversations. And then from there, then going back and working with those local funding agencies, the State Department of Economic Development, the State Department of Transportation, the State Department of Workforce, things like that. That's how I would kind of layer that in, because those state organizations are not going to want to talk to you until you have the local community ready and saying this is something we want to address together. And that really is a perfect question to close up that, because that is really what led to this program being successful, is that the Theta Care came together and said, what is a challenge in this community in New London? And they said transportation is a barrier. And they said, all right, let's all work together to solve it. And so the community came together, the employers came together, the chambers came together, the state saw the vision and invested in the program and said, hey, this seems like a group of folks committed to making things happen. And we've done it. And we have 530 folks and counting that we've helped get to where they need to go to support themselves and their families. And with that, we have about 5 minutes left, but I think I've answered all of the questions that are coming up in the chat. But I appreciate so much everybody for your time, for the 27 folks that are still on the line an hour and a half later. Just thank you sincerely to the state of Wisconsin, to the Board of Supervisors and Waupaca County, the Waupaca County Economic Development Corporation, Theta Care, Make the Right Happen, all the organizations that have came together to make this program successful. We look forward to seeing another webinar. We're going to crunch the numbers on all 3 years of this program. So stay tuned. And thank you so much for your time. And I hope everybody has a great rest of the weekend. So thank you so much and take care. Bye-bye.